All right, we'll begin now. So good afternoon to all our participants who have joined in for this session today on sexual health awareness. My name is Akshada Shinde, and I'm the psychological counselor working with Symbiosis Center for Emotional Wellbeing at ISB Road campus. So the theme for our webinar today is Turn It On, Sexual Health in the Digital World, which has specifically been chosen keeping in mind the switch to the online platforms for communication and connection, a change which has been forced on us by this pandemic. So during these tough times, some relevant questions have popped up, such as how has this switch impacted our mental health, our sexual health, and what are the challenges that we face in our sexual health in the digital world? To answer such and many more questions posed to us by a community of students and educators, we have invited a panel of guest speakers. So I will now introduce our esteemed panelists who are renowned experts in this domain in their respective fields. So I'll begin with Dr. Vinay Kulkarni. So he is one of the leading experts on this subject with more than 36 years of experience, and he has completed his MD in dermatology, venereology, rhetoric, and he's also a specialist in HIV/AIDS. So currently, he is the honorary consultant dermatologist with and the head of department at Dinanath Mangeshkar Hospital in Pune since the last 20 years. And Dr. Kulkarni also works with Prayas Health Group as a coordinator and medical director. It is an NGO that deals with creation of awareness, education, training, supportive care, and counseling for people with HIV/AIDS and other sexual health illnesses and diseases. Dr. Kulkarni has presented papers in this subject in various international and national level conferences. He has a lot of published book chapters. He has also facilitated training programs on with the government and with non-government organizations in various countries. And thank you, sir, for joining us today. So our next panelist today is Dr. Sangeeta Saxena, who's a gynecologist and author, a counselor and activist, and works in the field of life skills, sexuality, personal safety for over the last 25 years. She has a very versatile background, and she's also the co-founder of Enfold Proactive Health Trust. It is an organization that provides age-appropriate and culturally relevant sex education to children, adolescents, and adults in this area. Dr. Saxena has co-authored a series called On Track and has also created various awareness programs and workbooks on life skills and personal safety. She's also established a PG diploma program and a certificate program at Christ University on life skills-based personal safety and sexuality education. She has also presented various papers on this topic on national and international conferences. Dr. Saxena has advocated for and participated in developing policies with regards to the safety of women and children with state governments, and she creates a lot of awareness on these issues. Since 2018, she has also been acquiring training in restorative justice and restorative practices in the US and in India. And through her organization, she's also been promoting training in this field in schools, child care institutions, government, and NGO staff. And currently, she is leading a 3-year project which aims at building the capacity of teachers, educators, graduate and postgraduate courses in sexuality, gender, personal safety education, and empowering them to conduct sessions on these topics. So thank you, ma'am, for joining us. And I just request you to unmute and thank you.
Thank you so much for inviting me.
Thank you, ma'am. And our last final panelist is Dr. Anjendra Tarke, who has 11 years of experience in the field of mental health and sexology. Dr. Tarke is a consultant psychiatrist and sexologist, and he has his private practice in Kharadi in Pune. He is also a Symbiosis alumnus, He has completed his MBA in healthcare from SIHS, Symbiosis Institute of Health Sciences. And we are really excited to have one of our own alumni here as a guest speaker. Thank you, sir, for joining us. Dr. Targi has also worked with the Ministry of Health and Family Welfare and with many well-known IT firms. His area of interest include studying the complex relationship between mental health, sexual health, physics, philosophy, psychology, and neuroscience. He believes that understanding the intersectionality of these topics is central to working towards individual and societal well-being. So, thank you, sir, so much for joining us. I request you to unmute yourself and just say hi to our participants.
Yeah, hello all. Thank you very much for inviting me. I'm very happy to be here.
Thank you, sir. And finally, I will introduce the moderator for today's session, Dr. Girija Mhale. Dr. Girija is a consultant psychiatrist and she also heads our center, the Symbiosis Center for Emotional Wellbeing, which is a constituent department of Symbiosis International University. And after pursuing her MD in psychiatry from KEM Hospital in Mumbai, she did her fellowship in psychiatry from Australia. For the last few years, she has been working in the field of youth mental health, which she is very passionate about. I will hand over the session to ma'am, who will introduce this topic and our center.
Yes. Thank you so much, Akshada. A very good afternoon to all those who have joined us today for this session. And a warm welcome and namaskar to all the esteemed panelists who agreed to join in for this session at a very short notice. So I would like to tell a little bit about our center, what we do here at Symbiosis to our panelists, as well as to those who are from outside of Symbiosis, parents who may have joined this session today. So the Symbiosis Center for Emotional Wellbeing was established in 2018. We are a team of mental health professionals, young, dynamic professionals who are based across all campuses of the university. And we believe that mental health is a very holistic concept beyond just looking at mental illnesses. We strongly believe that the attributes and strengths that human beings possess can be actually developed and to build resilience and to combat majority of problems in our life, not only to help us prevent mental illnesses, but also help us to thrive and become a compassionate community in general. Therefore, we not only provide services that deal with mental health problems, but we conduct numerous workshops, seminars, awareness programs on various topics related to mental health that impact our day-to-day life. Very relevant topics to youth mental health, such as coping mechanisms, self-esteem, relationship issues, and of course, sexuality, which is definitely very much needed topic, and therefore we have this session today. So when we talk about sexuality, I believe that it's a topic that has always been a topic of curiosity, a topic of interest and analysis to entire humankind. I think right from early childhood, infants also engage in genital play, which is a part of normal development. And as children grow and hit puberty, the surge of hormones creates bodily changes and increases the desire for sexual intimacy and increases your curiosity as well. Unfortunately, though, our teachers through this journey are Tollywood, Hollywood, Bollywood, and all sorts of media, including social media, pornographic sites, etc. This often leads to misinformation and therefore can often lead to sexually transmitted diseases, unwanted pregnancies, sexual violence, abuse, and harassment. Therefore, providing factual and scientific knowledge is the need of the hour. Hence, we have very knowledgeable, experienced, trained professionals here today to guide our students and our community on this very important topic of sexual health. Without any further delay, let me begin by asking them questions which have been sent to us by our very own students. And I thank all the students for sharing their questions without any inhibitions. And I hope that this session today will help you to gain scientific information and knowledge. With that, I begin with Dr. Vinay sir. Sir, let's just begin with understanding the concepts very clearly. So, my first question to you is, what is sexual health and what are the various terminologies that come under the topic of sexual health?
Yeah, thank you. Good afternoon, everybody, and welcome to this nice session. But just as you talked in the introduction, we many a times relate the whole thing to growing up, genitals, hormones, relationships, etc. And I think sexuality is far, far wider concept than that. And when we talk about sexual health or sexual well-being, we are not only talking about this physical well-being, that pleasure is an integral part of that, but we always relate that pleasure in sex with intimacy or sexual intimacy. But that pleasure is not restricted when we talk about sexuality only to that. So when we talk of sexual health, typically a WHO or someone would define it as not mere absence of sexually transmitted diseases or pregnancies, unwanted pregnancies, or abuse, or etc., which forms the negative part of it, what it should not be. But it hardly ever talks about what it should be. And that is not only physical, but mental, emotional, and social well-being of a person sexually. And what does that mean? Because it's apart from just being sexually active, being comfortable with its own sexuality, our orientations, being honorable or respecting someone else's sexuality and the gender and the concepts about that, and then having and building relationships in which there would be a mutual pleasure. And this very essential and important aspect of sexuality is about mental health. And you are talking about your mental health thing. And mental health without a sexual well-being is rather impossible. Whether you are sexually active or not, it's a totally different thing. But you have to be comfortable with your own sexuality. And many times we just forget that this cannot be defined in a particular kind of a social construct, that sex after XYZ, sex after marriage, sex only with the same sex or heterosexual relationships, etc., is only normal. So what happens is our society is largely heteronormative, and anything falling out of that is considered a taboo or a stigmatizing thing. And that is the biggest problem. And so when we talk about a positive or affirmative sexual activity, I would say that anything that comes under the umbrella of physical, emotional, social well-being sexually would come under sexual health. It is not just absence of XYZ. What you talked was about reproductive health, which becomes a small part of a larger sexual health. But in that also, it is not only having safe abortions or safe pregnancies, etc., but to decide when I should have a baby, with whom I should have a baby, how many babies should I have, how can I use contraception, should I ever have babies? Because again, in this construct also, only heterosexuals beyond after marriage are kind of a normative thing. So having sex before marriage, having sequential partners, having simultaneous partners, etc., all things, and in which the partner becomes very obvious. And then the whole thing about consent, being respectful to that person's choices, and being completely non-harming to anyone. These all, I think, would be, we have a very short time to discuss all this, but this is in a nutshell, I would describe as what we would be talking about sexual health today.
Yes. Yeah, very rightly said, Dr. Kulkarni. You've highlighted a very important point that it's beyond just reproductive sexual health, and that it is applicable across age groups and across sexes, across genders, and that it starts from accepting your own self, from who you are with your sexual identity, with your gender identity, and then goes on to how respectful, how consensual and mutually satisfying relationships you develop. And sexual intimacy is a very small part of the whole thing. Thank you so much, sir. My second question would be to Dr. Sangeeta. So then, what is safe sex? Everybody talks about safe sex, but what is it?
So first of all, there's something like absolute safety. So it is safer sex. And I'm going to talk about at least four aspects of it. One is the physical safety aspect of it.
Mhm.
And in that we will include, say, safety from infections, unwanted pregnancy. So the condom part of it comes in. But if people are practicing whichever form of sexual activity that they are practicing, there need to be boundaries in that which define the safety of the person and the partners. So if there is BDSM being practiced, then the safety over there takes a different connotation, right? Besides all the others. So physical safety, safety from infections, unwanted pregnancies. Then there is your emotional and psychological safety. So you're going to look at whether the practice that you are in, the way you're expressing your sexuality, whether it is affirming of your own sexuality and it is respectful of the others involved. And then finally, there is the social and legal aspect of the safety. Is there legal safety in the sexual activity that you are indulging in? And for that matter, children below 18 years of age, I prefer to call them adolescents and not children. Our law does not give them the agency to give consent for sexual activity. So they can land up with trouble with the legal system. And of course, there is the other aspect of which brings into focus consent. So when we think of safer sex, please think of all of these and not only carry a condom and say, okay, I am having safer sex. No,
Yes.
there's much more to it.
Beautifully given us a very good overview of what safe sex is, and we'll definitely come to consent and contraception in detail in the next part of our session. But my next question would be to Dr. Anjendra. And sir, so we are hearing these terms: sex, gender, gender identity, sexuality. Are they? I mean, are they same? Are they different? There's a lot of confusion. Can you clear it for us, sir?
Right. So I think, Dr. Vinay Kulkarni has already touched upon this briefly. I'll just expound on that. This is an important question because, yes, this kind of confusion manifests quite commonly, not only in my clinic, but in general population, there's a lot of confusion regarding this. And before I speak on that, I completely agree with Dr. Kulkarni when he said, there is no health without sexual health. There is no health without mental health, and mental health is so tightly intertwined with the sexual health. Because, sexuality lies and sits at the very core of our being. We are all fundamentally sexual beings. So sexuality sits at the core. Now, of all the terms that you used, sexuality is a broad umbrella term. Now, as Dr. Vinay said, it's a very broad concept, but I'll not just, I'll add on to that. It's not just about, the reproductive functions or your own sexual orientation or how you understand your own sexuality. I believe sexuality is a part of your personality, and it's about creativity also. It's a creative force. I subscribe to the very Freudian notion of how sexuality begins at birth, and what the old term eros, which is associated with sexuality, is the creative life instinct. As infants and adults, children grow, out of, let's say, the purely sexual aspect, which we ascribe to, sexual intercourse, there is something called as sublimation which kicks in, where sexuality, in the most carnal sense, gives way to creativity. If that did not happen, there would be no civilization. So sublimation is required for creating society, but it comes at a cost. And this is exactly why you're here, because we must talk about sexuality right from the beginning and aspect and accept children, infants as sexual beings as well. So sexuality is a broad umbrella term. Sex, what is sex? I think for practical purposes, we can say sex is the biological activity of procreation, or very fundamentally what we are born as. So the biological aspect, the sex that is assigned to us, whether what we call as male or female, that is sex. However, gender. Now, before I go to gender, sex is something which can be changed. Case in point, examples in point are transsexual people, people who identify with a different sexuality. I think we'll talk about it later in a little bit more detail. But gender is a purely societal construct. It is a social construct which is created by us, by humans. I could arguably say it's a myth that we have created, and humans are creatures of myth. We like to create all kinds of myths, and myths are double-edged swords. Myths are necessary for us to coalesce together. We tell stories and we, come together because of these myths. But then there are inherent problems also. So where the problem comes is when we humans as a part of society start ascribing specific gender roles. And that has happened as a part of history, as a part of culture, as a part of politics. So all these socio-political reasons historically traced for which we have assigned these gender roles, that become problems. So for instance, in many cultures, even now, a man is supposed to, be able to do certain tasks. A woman can limit herself to only certain tasks, child rearing, taking care of the family, and so forth and so on. While the man is the aggressor, he takes care of the household income and so on. So in the world that we live in today, all these gender norms, are challenged. And then we start understanding that there are no fixed rules to it, and sexuality itself is fluid. We are all born pansexuals, and we are subject to various influences, right from genetics to the socio-cultural influences in the form of, sanctions, religious aspect in expression of our sexuality. So we could think of sexuality which sits on a spectrum.
Yeah, beautifully explained, sir. Very rightly said. It's a complex interplay of bio, psycho, socio-cultural influences that affect our expression of our sexuality in the world, isn't it? Okay, since we have now we are conceptually correct, we understand these various terms. Let us move ahead and take a few questions that have come from students. So students have very curiously asked about, yes, sir. Kulkarni, sir.
Just before we move, because you introduced all three of us as activists, Sangeeta madam said that there has to be a legal safety. The problem is we as activists have to look at the current laws, regulations, which are so inhibiting because they are a hindrance to expression and pleasure of so many sexual identities. And I think it's just not to look at if it is legally allowed or not, or legally safe or not, because there is so much of problem with the law. And I would like to have some expression from Sangeeta madam about that. It's not just about legal safety, but fighting the law also. Because we have to change the laws as per the community and the society evolves.
Totally agree, Vinayji, that the fighting is the job of the activists and the people. The individual, the 17-year-old who is having sexually is intimate with their partner who is 17 and a half. Many a time they don't know. They don't know that they can get into trouble. No, and when you get into trouble, so that is what I'm saying. And
I completely agree that child sexual abuse, consent, age are debatable things. But laws against same-sex relationships, same-sex marriages, etc. So it is not just one particular thing that individually there is something like a law and you have to abide to it, but it puts a lot of pressure on especially people with differing identities. That's just I wanted to flag. I'm not saying that
absolutely. I think, yes, we are evolving with our legal system as well. And as more and more clarity comes around identifying these different identities, our legal system is also gradually changing. And it's a matter of time that we will soon find ourselves legally accepting, differences with respect to legal ages for sex as well. So my next question would be to Dr. Vinay sir, and this is with respect to the current pandemic and the social distancing norms, the digital era, and which has brought on a number of online dating platforms. So, sir, can you share some of your recent experiences with young people and how sexual practices are currently with mushrooming of online dating apps?
I would answer to that dating apps on one side, but remind me of talking about what is happening with relationships also offline too. It's
Sure.
not just online, because the pandemic has really affected so many people offline too. But yes, there have been different platforms coming up, and it's not only for finding new partners, but the distance between the current partnerships, relationships also has changed. Not only people staying away from each other, but even staying in the same house as partners has tremendously been affected by this pandemic. And say, for example, two partners staying in two different bedrooms for seven months and wearing masks and talking to each other from 10-15 feet all time, do gaz ki duri rakh ke. That thing has happened. Relationships have started becoming online even within the households, then within cities, then of course out of the continents also, and that has affected the mental health a lot. Second thing would be these new platforms, and which have mushroomed, and there are so many people who are on the online platforms, and if there is some data available, especially on the pornographic side, and the use has gone up 4 times, 5 times, or I think even 100 times maybe. But I was discussing this some time ago, and I was saying that yes, we can discuss pornography a bit later, right or wrong or something like that. But probably these sites and the visits have helped a lot many people to keep their psychological, sexual, mental health also. Because without that kind of a approach, or at least access to something, they would have gone mad. So it's not only something, but again, with all kind of things, we know the bad things. People have been talking about people having been intimate on internet, then demanding certain things without, and people just giving that away because of whatever, for the lack of access or for the lack of confidence whether the relationship would break or not. So sharing naked pictures, and then the kind of shooting intimate scenes, and then being kind of a prey for blackmail and all kinds of things. So there is a lot of negative things that has happened also with that. And I would urge these people, is young people especially, or I don't think there is any age bar, but so across ages people have accessed social this networks for their sexual needs, I would say, in this pandemic period when everyone was separated from each other. But one has to be very careful about with whom they are talking, what they are sharing. Are they sharing some personal details, or are they likely to be subject to blackmail? Are they going to disturb or distract them from other relationships? Or is it, one really has to sit and think about it, that whether this is likely to affect their further relationships and their own mental well-being also, because it also puts a lot of pressure, especially for the girls. Like whether it would be leaked, whether it would be, because right now whatever you talk is, I think, is being watched by someone and can always be shared. So being safe, discreet, and choosing your partners is very important in this aspect. And I would like to invite the experiences of other panelists on this.
Yes, surely. And I would take this further to Dr. Sangeeta and ask her to share her experiences about whether, sexual violations, abuse, harassment have increased during this pandemic time. And also if she can share to our young audience on safe sexual practices, sexual hygiene, because these are some of the important areas that young people should be aware about.
Yeah, I totally agree with what Vinayji was saying. These things have increased. They were already on the rise. We did have all these things, social media, internet, cameras, which can just record everything. And once something goes on the net, it's there forever. You can never delete it. And it can be morphed and it can be shared and can be brought back. And we get high school students where one of the partners has taken a picture, and the next day when they go to school, 10 people ask about it, right? So being very, very careful about that. As for sexual hygiene, of course, it is, use of mechanical barriers like condoms, which do protect against a lot of sexually transmitted infections. And for oral sex also, use of dams and things like that. But I was just thinking about COVID, and when you're meeting a person and you're sexually interested, kissing is one of the first things that we do. And that is where you don't know, right? Who has COVID, who doesn't have. So getting your vaccine and being careful with that. So other than that, I don't see anything very specific for COVID as such.
Okay. That's very helpful because yes, the social distancing norms and wearing a mask has definitely inhibited many people to genuinely express their love and intimacy towards their partners. And therefore, my next question to Dr. Anjendra is, like, have you in your clinical practice noticed anxiety is increasing around having sexual relationships, or how do you think relationships have generally changed, and how has that impacted mental health in general?
It does. What happens is with social media, there's an illusion which is created that we live in a more connected world. We are, socially, we are more connected. We have thousands of friends on Facebook and Instagram, and we are constantly on groups on WhatsApp, etc. So the connectivity has increased, but the real connection, real world connections, those have suffered. So the authenticity or the, how relations should be, that has taken a little bit of a beating, because what happens is people tend to isolate. In the world of social media, where you portray a certain picture of yourself, you do communicate, you are chatting on dating apps, but that's a very comfortable space. And also on these dating apps or, portals like Instagram, Facebook, there are so many options which are available. So people don't want to settle down with one person. The more number of the options, the more possibilities. So people want to think that, okay, the possibilities kind of end up paralyzing people as for making choices. And that has in a way affected, consistency in relationships. Also, the isolated world already also brings into something where, people, because they are not able to step out, meet. I think Dr. Vinay was talking about the other aspect of, how relationships are suffering. I'll talk about the opposite aspect. Being cooped up, because of the lockdown, always, all the time with your partner can also be not a great thing, because, earlier you used to go out, socialize a little bit, hang out with your office colleagues, etc. So you would get a little bit of breather, little things which annoy us about each other. So that wouldn't happen. Now being together in the house all the time with work being online, so that can create the other set of problems, as far as relationships are concerned. Okay. But yeah, what suffers, I think, is people having that patience and giving time in building relationship, which is much easier in a world which is not so constrained because of the restrictions. So in that way, yes, we are suffering.
So true, sir. Yes, sir. Yes, sir.
I had asked you to remind me of the other thing. On the net, what we are talking about is relationships, friendships, and kind of things. But the pandemic has affected the economy so much that in my practice, in last 2 to 3 months, whenever there is an economic crisis, you know that transactional sex, in which money gets or something gets exchanged, is always on the rise, always.
Right.
And this is being seen in the villages as well as in the cities. And that is why we are also starting to see a lot of upsurge in STI, sexually transmitted infections. And when we were initially talking about safe sex or safer sex, it's very important because not only for the deprivation, but for the economic reasons, the sex has increased. And it is not only the young girls, young boys, housewives, kind of things, that kind of economic deprivation has led to a lot of transactional sex and increase in that. And the access is not in the classical things like brothels and call girls, etc. It is all gone online. And that's another very important effect of the pandemic that has happened. And I think we should be worried about it.
Correct. No, it's really very unfortunate that, unfortunately, it has really affected all aspects of human life. And as you rightly pointed out, even economy being affected can affect and increase sexually transmitted illnesses. So on that note, sir, can you tell us a little bit about sexually transmitted diseases? How do you identify? What are the common signs and symptoms? And how are they transmitted? And a little bit about contraception as well.
Well, how they are transmitted? They're transmitted mainly sexually, because that's why they are called sexually transmitted infections. But I'll start with one basic thing, that everything that happens on the genitals is not sexually transmitted, and not everything sexually transmitted always happens on the genitals only. So not all sexually transmitted infections would manifest with something on the genitals, but largely majority of them would. There are about 18 to 20 organisms which are sexually transmitted. And let's not talk about the names, but people know about syphilis, gonorrhea, HIV, hepatitis B, etc., which are very common. But there are 17, 18 kind of things. Majority of them have got symptoms, and majority of them are curable also. So what would be the common symptoms? Instead of going into the names and the bacteria and the viruses, there could be sores on the genitals after unprotected sexual exposure. There could be urethral discharge with burning, micturition, severe pain during passing urine. There could be discharge, especially among women, from the vagina, cervicovaginal discharges. In men, there could be discharge underneath the foreskin. There could be sores, and then enlargement of lymph nodes in the inguinal folds of the groins. That could be another thing. There could be some kind of outgrowths on the skin, which are called warts or HPV related things, or viruses called molluscum contagiosum can come on that. Then there are certain diseases which could cause ulcerations away from the genitals in the groins, etc. These are viruses and bacteria. And then among women, something called as pelvic inflammatory disease, in which the infection travels upwards through the vagina into the uterus and into the fallopian tubes and out in the peritoneum or in the abdominal cavity, and causes pain and fever and kind of things. And then there would be other diseases which will have no symptoms at all. For example, HIV. You acquire HIV and there would be no symptoms for years together. There could be hepatitis B, which could get transmitted sexually, and then you may get jaundice, but nothing on the genitals. So if you have had unprotected sex, or if you have had sex with someone about his sexual history and disease-related history is not known to you, you are not very confident about it, not a regular partner, and then if you develop anything of this, I think you should consult a STI consultant. But if you have had unprotected sex or anything with anyone about whom you are not sure, the best way would be to go and get your STI screen done, even if you don't have any symptoms, because then we will not like to screen you for the diseases which would give you symptoms. But we would like to rule out other diseases which can be transmitted to others, such as HIV. And that has to be done at least about 3 to 4 months after your high-risk exposure, because it takes some period for all these infections to develop in the body, or the antibodies and the test to become positive. So I would by and large thumb of rule say that At the end of 3 months, if your STI screen is negative, you can be reasonably sure that you are not infected with any sexually transmitted infection. But I would again re-emphasize that majority of them are treatable. So when you go to a consultant, take the treatment, complete the treatment, take your partner also for testing, because many times, especially men have the symptoms, women may not have the symptoms, but they may be suffering from the disease and they can keep on giving to each other. Complete the course of both the partners, observe safe sex or safer sex with condoms till the doctor tells you that you are completely cured, or maybe whatever, depending upon the disease, as long as possible. Learn to use measures like barriers, whether it is female condom or a male condom or something, because barriers is the only thing that protects you against sexually transmitted infections. There can be tablets for prevention of HIV, but there are no other. But barriers would prevent you from almost all sexually transmitted infections. So STI treatment comes as a package. It's not just giving you medicines and saying that take this or this shot and you will be cured. It has to be a sexuality and safe sex education at the end of that session also. So that I would say is the comprehensive kind of a sexual transmitted disease clinic approach would be.
Correct. Sir, can you tell our audience where can they actually access these kind of clinic services for STDs?
All the medical colleges would have a skin and STD department where the things would be available free. In government medical colleges, in private medical colleges, there may be some charges, but it is available there. And that's the first thing I would like to tell. That it is not that you have to always spend something. Second thing, go to a qualified MD or diploma skin and STD consultant. Don't go to the quacks. And I would say that for every qualified STI consultant, there would be at least 100 quacks around. And that वो हम देखते हैं ना, public toilets में बचपन की हुई, etc., etc. And then there are tents by the riverside, and then on the railway station there are advertisements, and then someone coming 15 days a month or every 15 days to your city and having a practice of thousands. That's all horrible. If you feel even a qualified consultant is kind of exploiting you, stay away from them. I will give you just a recent example. Someone was suffering from syphilis in Mumbai, one of my patients. And a consultant said that you would require benzathine penicillin injection, and there would be 6 injections, and the cost of every injection would be 10,000 rupees. The injection cost 12-13 rupees. And the mother asked that doctor, why 10,000 rupees? And he said, so that he doesn't do the same thing again. No, I think that's not the job of your STI consultant. Your education has to be different. He has to be safe. I'm not saying that. But exploiting like this does not prevent safe behaviors. Definitely not. He's going to just run away after the first shot, and he's going to have an incomplete treatment. So I think these kind of things one should be really worried about and scared of. But at the same time, there are numerous, I would say, quite a bit of, in Pune, there would be about 350 odd qualified STI consultants and the government departments, and you can access treatment for your STIs there. Of course, I am not advertising, but an organization like Prayas is providing all these services at extremely concessional rates. Every year we have STI screening month, every December, free. We will screen all STIs free. And so you have to search for good places, go there, get a good advice from the doctor as well as a counselor. Don't forget to meet the counselor after you have seen the doctor if the doctor has not counseled you. So thank you.
Just to add on what sir has said, because everything about sexuality, people are so shy, embarrassed about it, and there's a lot of fear associated. That is where this quackery builds on, thrives on. So make sure you're, researching and going to the right specialist, a qualified specialist, because like sir said, I would go on to say for every one qualified specialist, there are 1,000 quacks here in India, all kinds of quacks. So being careful, being just forthcoming about whatever your inhibitions are, I think going to the right professional is absolutely paramount.
Correct. Absolutely, sir. I think the secrecy also involved around it, especially among unmarried partners. And therefore the society not accepting of this also then creates a lot of shame and guilt. And that's one of the questions, in fact, that I would like to ask Dr. Anjendra is how do you deal with guilt? If you've had a sexual relation, you're not married, uh, and then you start feeling guilty about it. This is one of our students has asked this. How do you deal with guilt coming out of it?
Right. See, guilt fundamentally is a very pathological emotion. Like, it weighs you down and becomes a central emotion in a lot of psychiatric and sexual problems that people manifest with. But, it's not such an easy question to answer, because you mentioned about, having a relationship, having, let's say, an illicit relationship or an extramarital affair or an affair outside your primary relationship. So that becomes a very complex situation. The primary thing that needs to be done, as to why exactly is this happening? Why did I have to go and have a relationship outside my primary relationship? That itself gives you a lot of information as to what is happening. Maybe what is missing in my relationship, or what is unexplored about my own personality. What kind of relationship do I want? So these all aspects and many more get covered when a person starts talking to a psychiatrist or or a therapist, a counselor, because that is where it opens up channels to a lot of unresolved and suppressed emotions. So to answer how to address guilt in a very such a short kind of a forum, it's very difficult, because it's a very complex emotion, and many times people are weighed down for guilt for no good reason. It can be a very irrational emotion as well. So what I would say to that is, taking help, as far as therapy is concerned, counseling is concerned, and exploring that emotion and understanding the complexities of what is happening in your relationships will give you a lot of answers.
Yes, very true, sir. I think a detailed assessment, exploring why that emotion is arising is very, very important. My question would be to Dr. Sangeeta now. Sir spoke about use of barriers in preventing STDs. Would barriers then be 100% effective to prevent unwanted pregnancies and educate girls about how they can avoid?
Yeah. In 20 years of interacting with students of all ages, what stands out is that their unshakable faith in the power of the condom. उनको लगता है ये लगा लिया तो ब्रह्मास्त्र है, अब कुछ नहीं होने वाला, अब मैं जो भी है वो कर लो, कुछ नहीं होने वाला. But nature is much smarter than that. It has been at the job of making babies in so many ways. So condoms do have a failure rate, and that failure rate varies with the usage and how consistent and all of that. But it does have a failure rate, and it is much higher than the other contraceptives like an OC pill, which has a very low failure rate if it is taken consistently. So one thing is to condoms, yes, that is the best thing we have for prevention of STIs. That's for sure. But for prevention of pregnancies, now if you're if you're having regular sexual activity, then there is a need to go on some form of regular contraceptive, which has as low failure rate as can be managed. And anything other than condoms and use of gels and all of that does require a consultation with a doctor. There are side effects, and there are some diseases that run in the families where use of a pill would become contraindicated. So that is one thing. And the other thing that is there is, of course, for condoms, early on and early off. Putting it on early in the sexual activity, because the secretions that come out from the corpus gland and all would carry some sperms, and that could lead to pregnancies. So early on and early off. So when after ejaculation, the size of the penis would begin to reduce, so it can slip, and so early on and early off is a thing. And to use only one kind of condoms and not use two just to increase its, no, it doesn't work that way. If a phallic condom is being used, don't use a vaginal condom at the same time, or try to use two condoms. No. Other thing is, sometimes I've seen people use what we call as emergency contraception. iPill is a very famous brand for it. They use it like a contraceptive. हर बार sex किया, उसके बाद में within 72 hours go and pop these 2 pills or this 1 pill. No, because these are meant for emergency use once in a while, not twice in a week. No, please, if it is something like that, go on a regular contraceptive where studies have been done and side effects are known and everything is managed. These emergency contraceptives have a very high hormone dosage in it, which is not really to be taken just off the cuff like that as many times as you want. So within 72 hours, taking an emergency contraceptive, if your regular contraception has failed or the condom has a tear in it or something like that happened, yes, do take it. But then again, there may be a 40%, 50% failure with that. And so it is important to, after the periods happen, or if they don't happen, after 2 weeks, to do go for a checkup to see that things are okay, or if something has to be done, then something has to be done. Now, coming to if there has been a pregnancy, then what do you do? Right? Yes. Then it is better to be proactive, to look out for it, not wait for months and hope my periods are missed, because of something else, because of my exam or this or that. No. If there
Did we just lose Dr. Sangeeta there? I think so. Her internet is possibly shaky. Yes, Dr. Vinay.
Yeah, I think her connection has gone, but I wanted to add a bit to Ajin, just talk about thoughts about guilt. And as you said that a lot of faculty and parents could be on this forum.
Yes.
See, guilt many times doesn't occur naturally from within, just because it is many times given by the people. So if you are approaching a counselor or a teacher or a parent or a doctor or a counselor, whosoever, if you have had a pregnancy, as she was talking right now about, and you have had a relation, you are unmarried and go to a gynecologist. I think the primary job of the gynecologist is to provide safe abortion and not to judge that girl there. That could be done at a given time, because a lot of times this guilt is being given by people. It's not only about pregnancy, just because for relationships, if the first expression from the person you are talking to comes as you have done something wrong, then the guilt would start from there. And I think that is one thing which we should definitely avoid about it. We can discuss about it, why you are feeling, etc., etc. But I think all seniors have to keep that in mind, that we are not transferring guilt to the people unnecessarily.
So I completely agree with what Dr. Vinay has said. I think, but the question was specific to someone asking that the guilt associated with having a relationship or a sexual encounter outside a primary relationship. But I completely agree with what you have to say. Yes.
Yes, Dr. Sangeeta, I think we lost you. So you were talking about very important topic. If someone does get pregnant, then what do you do? Ma'am, you're on mute.
To be proactive about it, if the periods are missed within a few days, go for a checkup, do a pregnancy check, or do go for a checkup, because within the first 7 weeks of pregnancy, it can be terminated fairly easily using just medical means. Certain kind of tablets to be taken again under medical supervision, though they are sold often by pharmacists. You can buy them, but there can be issues. There can be incomplete abortion, and then a curettage would be required and things like that. So these are the things to remember: 72 hours for emergency contraception, 7 weeks for medical termination, pure medical termination of pregnancy, and then up till 12 weeks, fairly easily, fairly safe surgical termination of pregnancy is possible. And as such, termination of pregnancy is can be done up till 20 weeks and under certain circumstances, even 24 weeks. So continuing a pregnancy should be the choice of the person who is pregnant. It does not require consent of the parents, the partner, the husband, of whoever it may be. It is a right, and we have had this very progressive MTP Act in India for a fairly long time.
Yes.
So, yeah.
Yeah, very important points that you've highlighted, ma'am. One, that it's very important to seek medical advice if you want to take your OC pills. For use of emergency contraceptive pill, again, do not make it random use of emergency pills. Only use it when absolutely necessary, again, under medical advice. And if always seek a doctor's help, if you find yourself to be pregnant, do get your test done immediately, the UPT, the urine pregnancy test, to find out if you're pregnant, if you've missed your periods. Is there something called a safe period, ma'am? Many girls ask us.
Yeah. Very unsafe. A very unsafe period, which we would say is I would just make it even a 10-day rule. The first 10 days after your period, from the first day of your period, it is unsafe. The middle 10 days of the cycle are fairly safe. And then the last 10 days, again, it is a pregnancy is unlikely. So first 10 days, unlikely pregnancy, middle 10 days, pregnancy is very likely because ovulation and all is happening. And then the last 10 days, pregnancy is again unlikely. But the point is that ovulation is not fixed. It varies 2, 3, 4 days, plus minus. The sperms can survive in the genital tract for up to 3 days. So you add it all up and you have a whole range of timing when pregnancy can occur. And another thing is that one day, if a couple has had sex only once and they come like that, ma'am, only once, only that one day I had, and now I'm pregnant. You know what happened? Because on that day, probably you ovulated, you were looking your prettiest and the best, because that's what nature does. Sexual attractivity is very high that day. So, and your own desire to have sex is very high. So if out of all the 28 or 30 days, you're going to slip, it's that day that you will slip.
So true, ma'am. Thank you so much for that information. My next question is to Dr. Vinay, sir, and some of the students have asked, what is phimosis? Yes, ma'am. Did you want to add
just
something?
one more point? Coming to this examination, a child above 12 years and up to 18, for any examination and gynecological examination or termination of pregnancy, the consent of the child is required.
Correct.
After 18, the person can give. But even from 12 years onwards, it's not that somebody can force you to have an examination, can force you to have a termination.
Yes. Okay, so over to Dr. Vinay, sir. Sir, what is phimosis?
Phimosis is a medical terminology. If you look at the anatomy of the penile structure, what we have, a very sensitive portion at the front of it is, which is called as the glans penis, and there is a covering of the skin over that, which is called a prepuce, and then that keeps on moving forward and backward, and that's called a prepuce. In many cultures where they do circumcise at birth, this is the foreskin or the prepuce which is cut off. But this foreskin, if it becomes tight, if it becomes very difficult to retract, it is called phimosis or phimosis.
Right.
It can happen because of swelling. It can happen because of sexually transmitted disease inside. It can happen because of skin problems at the end of it. Sometimes the phimosis or phimosis is not too tight, but what we call as a partial phimosis. What happens is during erection, the foreskin goes back, and sometimes it is very difficult that it will come back. And then there would be a swelling because there would be a ring and there would be a cutoff of supply to the forward skin or the foreskin, and this is called as a paraphimosis. When it is retracted back and it cannot be taken back to the original position, it is paraphimosis. And when you cannot retract at all because of the narrowing of the opening in the front of the foreskin, it is called as phimosis.
Right. And what are the treatments available for that?
It will depend upon the reason. If you have got, say, a recent sexually transmitted infection like, say, syphilis or a soft chancre or something, and you have got a swelling, you just treat the disease and it will go. If there is a skin problem, like, say, it is called as chlorosis, it's called as balanitis of the disease, it can be treated with antibiotics and steroid creams. If it is too tight and progressive and there is a skin disease, then it can be circumcised, which is you just take it away, which is sunnat bolte, but it's like circumcision.
Okay, sir.
I'll just want to
add. Circumcision at birth or early childhood is a very good thing because it prevents, to a certain extent, transmission of HIV, transmission of sexually transmitted infection, and it does reduce the incidence of cancer of penis. So hygiene-wise, it becomes much better. But if it doesn't mean that it is mandatory, because if you are having proper hygiene with the foreskin, it should have no problem.
Okay, sir. All right. My next question is to Dr. Anjendra. Sir, there are a lot of questions about the practice of masturbation, and again, a lot of myths surrounding the topic. So, can you tell our audience about it?
Yeah, it is one of my favorite topics because I see patients day in, day out with these problems, getting all sorts of confusion regarding this simple, basic, very healthy act of masturbation. Before I go that, because, Dr. Vinay was talking about, phimosis. So I get a lot of patients with erectile dysfunction or premature ejaculation. When I start talking to them, I discover many times that they've been having phimosis. So anything during the act of sex is interfering with the act of sex, which interfering with pleasure mentally, is going to cause premature ejaculation or erectile dysfunction. And many times it's discovered that it's phimosis. So that is one thing that, guys, men, you need to know about that. The other aspect is very basic, it's an aspect of hygiene, which unfortunately is, missing in the basic education as far as transferring knowledge from a father to a son. I see many educated men, from very, cultured, very educated, highly educated men who have not been indulging into a simple basic hygiene practice of retracting the foreskin during taking a shower, during taking a bath, and cleaning it with soap and water. When they do not do it every day for years together, urine, smegma, ejaculate gets accumulated and that area becomes hard. And that itself can result into phimosis, or difficulties during sex. So men, women, whoever are listening, so that is a very basic aspect which needs to be understood as well. Coming to masturbation, see, there are very simple, I'll make it very simple, Masturbation is a very healthy act of sexual release as long as you're doing it when you're sexually aroused. If I'm a man, if I'm a woman, I can masturbate till the time I'm sexually aroused, till the time I die. There is no problem with that. It is just that it starts becoming a problem if I start masturbating by forced external stimulation. So for instance, I'm just getting bored and I'm switching on pornography, and then I'm needing more and more and more in sexual stimulus for me to achieve that kind of sexual excitement. Then it starts becoming a problem because then it can interfere with real life sexual experiences, because porn and watching masturbating is a very comfortable activity, whereas sex takes some effort. It's a mutual activity of pleasure. And I see so many men and, especially men, who start preferring masturbation over sex, and they start having sexual problems like, reduced their partner and all of that. But masturbation per se, when I'm sexually aroused and I do not have a sexual partner or my partner is not in a mood, it's a completely healthy activity. So there are no problems with that. There are lots of myths floating that, masturbation causes weakness, causes hair fall, it causes acne, and all that is nonsense. Many men come to me saying that, gym mein power nahi aajkal, weakness aa raha hai, weights nahi utha pa raha hu, all kinds of things. I have seen so many severe cases of even depression, anxiety, and even psychosis because of this deeply ingrained idea that I used to masturbate and it's something very sinful or very bad that I used to do. And men just stop masturbating because of all these, ideas floating on the internet or heard from someone, etc. And then they start having nocturnal emissions, what we call as nightfall, which is again a very natural thing to happen. Because if I'm a man, if I'm having sexual urges, I will either masturbate or I will indulge into sex. If I don't do that, the sexual desire will find its way through nocturnal emissions. So nightfalls are also a very healthy expression. There is nothing to worry about. You have sex, you masturbate, the nightfalls will stop. And there is almost no nutritional value to semen. So if you're thinking that because of your ejaculation, you're going to get weak or you're going to lose hair or etc., it's all nonsense. Okay. And guilt, because you mentioned about guilt, and since guilt manifests so commonly in mental health, mental illnesses, this is one central aspect. Many men especially, start experiencing prolonged feelings of guilt because they masturbate or every time they masturbate. So when I do an activity which I think is wrong, for instance, I steal something or I perform a robbery, so I will be constantly thinking of that I've done something wrong. And that can start becoming the overwhelming, pervasive experience of my life. I start becoming anxious. My thoughts are constantly running there. I lose sleep over that. So this is how people develop something like anxiety or depression as well. Because I'm thinking of masturbation, a healthy expression of sexual release, as something that I've done wrong. And if I carry that thing too rigidly and I keep feeling guilty about it, can create a lot of havoc with my mental health. So I hope I've made it clear, as far as masturbation is concerned.
Absolutely, sir. And very rightly said. Not only does it cause any weakness, but it will not cause any form of weakness, but it will not even affect the sperm count of men, right?
And one more thing, because people indulge into sexual activity, people who are into relationships, who have sex sometimes every day, multiple times, people who are married who have sex any number of times. So then they're not worried about the release of semen and whatever is associated. Why have we, blamed masturbation? Of course, there is a whole historical basis for that. But, the analogy works sometimes that if you can have sex multiple times, you can masturbate whenever you feel like.
Correct. Can women masturbate?
Oh, of course. Since I repetitively uttered the word men, men come with these problems. But these days I've been having so many women also openly discussing about these problems. And when a man comes to me with a sexual problem, I always recommend them that this is a problem of the relationship and the dynamics between the two of you and not just you. So the woman has to be a party of that process. And as men masturbate, women must explore and masturbate, because unless you do not know your own body and what you stimulate, what way you stimulate, you will not be able to guide your partner as to how you're going to get pleasure. So yes, it's a very healthy activity. And also, see, I get a lot of patients with unconsummated marriage, where they've been married for a number of years, but they have not been able to have penetrative sex. And I've had cases for as long as 10 years and 11 years where they've not. And suddenly then they start planning a child. That's where they come to me. The thing here is missing is the woman in question many times has just not explored. And there is this part of their sexuality. And there are so many fears associated with sex, that it's going to be painful, it's bad, it's dirty, it's disgusting. So the simple act of masturbation, in fact, I have made it, a part of psychoeducation or sexual education. When men and women come to me, I ask them, do you indulge into masturbation, and why not? And if not, what are the ideas that you carry about masturbation? So that simple act of exploring your body through masturbation can open doors and channels for sexuality, not only for the individual, but also for the relationship. Because sex between couples is an ever evolving process.
Wonderfully explained. So then that brings me to Dr. Sangeeta, and many women have asked this question. What is vaginismus?
Vaginismus? Yeah. So that is an extension of what was being talked about just now, that it is disgusting. And besides that, there is the fear of sex. And somehow the more difficulty you have and the more pain you experience during sex, the more chaste you are as a woman. And so all of those feelings are there, but at the same time we have a huge amount of child sexual abuse and abuse of adults, sexual abuse of adults, all of which can then later on manifest as vaginismus.
Right.
So the point to understand here is that it is not a physical situation. The condition is caused by a psychological effect, which then makes a person so scared of anything penetrating in that area that they just freeze up and they tighten up, and then nothing can happen over there. So it requires more psychoeducation and relaxation, and then into the history, sexual history of the person, and removing this guilt and making sex a normal part of a person's life right from birth onwards. So the time when we hit a child on the hand and say, "Chi, through dirty, go wash your hands because you were touching your genitals," we have put chi through dirty, and we have messed with the child's sexual life. We have no business doing that. Right? And then we said shame, shame. So then when I do something shame, shame, and then of course we sing about it, huh? मैं तेरे साथ करूँगा गंदी बात. I mean, what? Why is something which is so pleasurable, so normal, so natural, so integral to our health, being painted in this manner? So yes, vaginismus would require that kind of treatment. People often assume that because the hymen is there, it was going to be difficult, or if penetration has happened very easily, then there is no hymen. That means that there is no virginity. That means there is no chastity. That means there is no, excuse me, no. Hymen is just a piece of membrane, nothing else. It's a very thin piece of membrane that stretches across the opening of the vagina. It can have multiple holes. It can have one biggish hole. It can have a very small hole. It does have certain several openings inside or holes inside it through which the menstrual discharge comes out. Very, very, very rarely we have a child born with imperforate hymen. And then that child doesn't get puberty, doesn't get menarche, doesn't get periods, and they're brought, and then we see that the membrane doesn't have a hole. The hymen doesn't have a hole. We make a small cut, and then everything's fine. Naturally, most women have different the openings, and I can't imagine that such a small piece of membrane and there is tomes written on it and so much myth on it. It can break while cycling, while doing vigorous exercise, running, inserting tampons, injuries, and on the other side, depending on the elasticity of this membrane, depending on the amount of vascularity and the blood vessels and the nerves in it, sex can happen and the hymen need not break.
Yes.
So neither does it indicate virginity, nothing. It indicates nothing. It's just one piece of membrane. Come on, yeah.
Yes, very true. You've cleared our myth around it. That brings me to Dr. Vinay. Sir, there are a lot of myths around the size of the penis. And boys have also asked how many orgasms can they have? What is the duration of, how can we be long lasting in a sexual intercourse? These are some of the questions that we get in our sessions.
I'll come one by one. And I would say that don't worry about the size of the penis because you have to enter only a vagina. Okay. And when a gynecologist examines it, he examines like this much, and is able to palpate everything. So if an erect penis is of this size, it is rightly going inside the vagina and is sufficient enough. Beyond that, there would be variations. One has to understand that you should have an erection which is good enough to penetrate. Because for women, actually, the outer 1/3 part of the vagina is having sensation and pleasure, and inside it has nothing. We were talking about masturbation, and one of the most important organ among women, which is the most kind of a erectile or sensitive one, is the clitoris, which has nothing to do with the vagina. So it is again, so you can still stimulate the clitoris, you can still penetrate, and you can still go inside, and then this much is the size, which is good enough. So don't worry about that. Unfortunately, this myth about size again comes from these quacks, then the advertisements with horses pictures, and then watching a bit of pornography, which is a kind of a myth. And I used to, I still, whenever I go for sexuality education thing, I find that there is hardly any man standing in a men's washroom trying not to look at someone else's size in the young days. You know, teri kameez meri kameez se safed kyun nahi? This is all that is created about this myth about the size. Okay, so that's completely a myth. If you are not able to penetrate, if you are not able to have good enough erection, then you have a problem, which most often happens to be a psychological or mental issue. Doctor would agree with me. Very few times it would be a physical problem, say because of nerves, because of diabetes or something. It's not only individual, it's a relationship problem, because many times if the woman says to a man, "Kyare mujhe pleasure nahi mila," so it's not okay, fine. Today there was no erection, there was no sex, it's fine. Tomorrow we can have. But this macho image that कि मैं किसी को satisfy नहीं कर सकता हूं तो मेरी मर्दानगी खत्म हो गई. No, that kind of myths about masculinity created right from the beginning put these problems into the minds of the people, and they have to be really dealt with very sensitively, at the same time with patiently also. How long a sex should last? I think there is no standard time. One thing. Second thing, it is not definitely as is shown in the pornographic films, which go on for 40 minutes, 50 minutes kind of a thing. It doesn't happen. Sexual pleasure, intimacy has three kind of phases. One is foreplay, play, and after play. All have very important phases in that. And actually the play, the penetration could be a few minutes here and there. It's definitely not in hours. Definitely never in hours, unless you are kind of completely having some kind of a problem. So don't worry about that also. See that you get your own ejaculation and orgasm, and partner also gets the orgasm. And if it is not, maybe you try the other time, next day, etc., etc. It's not always that everyone would have orgasms simultaneously. It's not always it happens. There are so many factors: mental stress, work stress, physical disability, physical weakness, or tiredness or something. You are having sex just for the sake because your partner wants it, but you are not ready. And then you may not have a good orgasm, but it's not against the consent, but you are given the consent for the pleasure of the partner. Okay, so these all things matter. Women can have orgasms sequentially, repeatedly. But men, how often? As doctor said, as many times as you can have sex. But usually in men, after an orgasm or ejaculation, it takes some time, say like an hour or so, before the person can again have erection and be able to perform sex. But women can have sequential multiple orgasms. So majority of the questions seem to have come from the boys. It seems from that. I think, this is all men-centric discussion going on.
No, sir, no, I don't think so.
Frequency kind of thing.
Okay, that brings us to Dr. Anjendra, and a very important point that Dr. Vinay spoke about, myths that pornography creates. So, sir, tell us about these myths perpetuated by porn, and something about porn addiction, because we do see a lot of cases of porn addiction as well.
Right. I think I'm glad you've asked that question, because I'd like to also add upon what Dr. Vinay and Dr. Sangeeta also mentioned. See, one basic principle about the size of the penis, I tell all men who ask that question: it does not matter how deep or how much circumference the penis occupies inside the vagina. Like sir already mentioned, that it's the clitoral stimulation which matters the most, and that is why foreplay is paramount. So if you're really thinking in terms of performance, men, then you should be thinking in terms of foreplay. There is no universal principle as to how long one should last. It varies, and it also varies depending upon your mental space. When you are in a much more relaxed state of mind, you might readily want to have another, you could get an erection instantly within a few minutes. Whereas if you're stressed, you might not get an erection, in the next 2 or 3 days as well. So it depends on your headspace as well. As far as coming to porn, before going that, Dr. Sangeeta was talking about vaginismus. This also becomes a factor in relationships where men come with sexual problems, and women are complaining many times that, okay, my man cannot satisfy me, he's not able to penetrate. And then men starts doubting themselves that, I have erectile dysfunction, it's me. So many times it's the vaginismus which is the problem, where the man does get an erection, but because of the woman's fears, you know I'm sorry. Because of the woman's fear and because of the involuntary contraction of the vaginal muscles, the man is not going to be able to penetrate. And that's where the erectile problems or premature ejaculation problems come from. So I just wanted to, press on that issue. Coming to porn itself is not a problem. Yes, the factors regarding the size of the penis and how long one should last, etc., also comes from comparisons with pornography. Pornographies are movies, they are entertainment. They are nothing like real life sex. And the people, the actors are cast in a way with what we like to see. It's, for instance, it's like Bollywood and Hollywood actors, everybody has six packs. So I ask, an ordinary man coming to me, does that make you any less of a person if you do not have a six pack? So similarly, in pornography, they choose men with bigger penises for that reason, because we like to see that and we like to believe that bigger is better. So those comparisons become a problem, and men and women both compare. And women also believe sometimes, women believe that if a man's penis is bigger or broader, it will give me more satisfaction, or a certain number of, minutes or hours, if they can have sex, it's better. So it's not, porn can also, however, be a reference point for, let's say, spicing up your sex life, using some of the things to, enhance your sex life. But if you're comparing that to your real life sex life, then you're in for a lot of disappointment. As far as pornography addiction is concerned, I maintain that, like any other tool of entertainment, porn essentially is not a problem. See, why pornography sells? If you go do a quick Google search, the pornographic websites are the most abundant websites about anything in this world. Why? Because there is a need, because people want to consume it. And all kinds of porn, which we call as unnatural porn, etc. So what is happening is porn is depicting something which is inherent in us. So then it comes to the question of how we use the tool, So if porn becomes the primary source of education, then we are in for trouble. And that is what happens in countries like, us, where parents do not educate, there is no talk of sex since childhood. So the first, portal to understanding what sex becomes porn. And that's where, problems become. As far as addiction is concerned, like I said, if people start using porn as a repetitive external stimulation device, then it can lead to addiction. Why? Because the world of pornography is endless, it's limitless. And what it does is, it has the potential of increasing the threshold of your sexual excitement, that you keep wanting more and more and more stimulus. And then that starts becoming a problem. And then that experience will not match up to your real life sexual encounters. So in that way, yes, pornographic addiction is real, but sometimes it is exaggerated because of a fear. And porn per se, I maintain, porn per se is not the problem. Your values, your thinking, your education, what you bring into it is the big problem.
Yes, that was very, very helpful. I'll come to Dr. Sangeeta with a couple of questions. So then sir pointed out that children or parents don't talk to children about sex. So what is the right age of talking to children about sex, and vice versa? How can children communicate with their parents about sexual health? That's the question number one.
So the right age is right from the very beginning. When the child is born, you're cleaning the child's genitals. What is the expression on your face? Then later on, when you're naming the parts of the body, are you completely silencing this part? Are you giving some names like this is your flower or this is your parrot, which then children use to report sexual abuse, and then the parent doesn't understand because they've forgotten I've named it the flower. And the child is saying, uncle is touching my flower, and the mother says it's all right because she thinks it's a flower in the garden. Naming the parts of the body. I'm not saying if you're not comfortable, you don't speak English, don't call it vagina, vulva, scrotum, penis. No, whatever you're comfortable with, but which is unambiguous. It has only one meaning, which can be understood by the ayah in the primary school. It could be called the susu place. It could be called the potty place. And as the child grows older, you can replace it with the proper names. Yoni, Shishna, whatever. But do give proper names. Teach the child sexuality etiquettes, just like you teach a child, namaste karo, bolo, aiye, baithiye, pani piyenge kya? So like that you teach. We keep these parts covered in front of people. So when the child comes running, 2.5-year-old child comes running naked into the drawing room, don't say chi chi thu thu, shame, shame, poppy, shame. No, just say, bitte, go and wear your chaddi. If the child says, no, it's very hot. No, see, everyone is wearing. No, these parts we keep covered in front of others. Jao, kapde pehen ke aao. Similarly, the child is touching themselves. Make space for that. They have a genital phase. Until 1.5, 2, 3.5, they will be touching themselves. And around that time, they start walking and they explore their peers' bodies. So make space for that socio-sexual play of the child. And children are playing together, 3, 4, 5, 6, 7-year-olds. They often go into the bathroom, they show their genitals, they touch each other's genitals, but they do not force anyone. They do not do it with pain, with anger, with violence. No, that is an indicator that the child may have seen something, maybe being subjected to sexual abuse. But let them explore each other's genitals. Among peers, it's absolutely normal. It is a normal sexual development. Don't mess with it. And don't, so that is one thing. And you can, after that, when the child asks you any question around reproduction, how did the baby come out? Don't say the doctor gave it to me from the hospital or by cesarean. Nahi, 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 nahi. Explain, use simple terms. And there are various apps available. Enfold has also made a Surakshit app and a Bal Suraksha app where we explain this using words like baby cell, mama baby cell, dada baby cell, baby house, baby birth passage, like there's a food passage, there's a air passage, like that. There's a passage for the baby to come out. Where is that? Near mama's susu place. That's why mama's bodies are different from dada's bodies. How did the baby get in there? No, the baby didn't get in there. It was just a small little baby cell, because our bodies are made up of little baby cells, right? Little cells were made up, like the house is made of bricks. So when mama's baby cell and dada's baby cell meet, the baby begins to grow. It's a tiny little cell. So mama and dada want to come very close together and they want to make a baby. आपने पूरा बोल दिया, आपने झूठ कुछ भी नहीं बोला. You have used words that the child can understand. And that is age-appropriate sex education. Age-appropriate sexuality education. Answering the child when the child first asks that question and using words that the child can comprehend. And then you can build on it. You can build everything on this later on. If you have not done it, please don't say, oh, I didn't tell my child when the child was 2, 3, 4, 5, 6 years old, so ab main kuch nahi bol sakta. No. Anytime, any place is fine.
So very beautifully explained, ma'am. Very, very
And
beautiful.
one more point is there, is about sexuality education is not only for children or for adolescents, it's for adults as well as for the elderly. It's also for the elderly, right? So we have so much taboos around the elderly sexuality. Our young people who are listening here, if they're an elder person in the house said, I want to get married, what will they say? Will they stand up and say, "Aap ghar ka naam barbaad karoge"? Right? So think about that as well, and about disability.
Correct. So yeah, that comes to the second question on sexuality and disability.
Yes. So we have been focusing a lot on the genitals. and the sensations from the genitals and the orgasm and all of that. But let me also say that we call as intercourse, but there's a huge sexual practice which is called outer course, where you explore other erotic parts of your body, beginning from the head and the scalp and the ear and the back of the ear, the earlobes, the neck, the abdomen, the small of the back of the knee, the wrist. The entire skin is sensitive to touch. It is the largest organ, sensory organ, and we use all our senses when we say we want to enjoy food, or you use all your senses, no? So it's like that for sex also. Enjoy all the senses, engage all the senses. Doesn't matter if because of locomotor or neurological disabilities, there is no sensation in that part. Genitals are out of function, can't reach them. Okay, doesn't matter. Orgasm can still be achieved by stimulating other parts of the body, and sometimes even without touch. Just by fantasy, just by visualization, orgasm can be achieved.
Very well said, ma'am.
This is an important point, not just for disabled people, but people who are not, because people like to think of sex in terms of penetrative sex as the only, the main course of the act. Like ma'am beautifully has explained, sex is much more than that. It starts from, the entire skin is an erogenous zone.
Yeah. In many of the, maybe we are winding, but many of sessions, I have asked this question, which is your most important sexual organ? And people keep on talking about penises and vaginas. And I think it is up there. It is the emotions, is the pleasure, it's the companionship, it is the relationship, it is short-term, long-term, which is most important thing. Everything else would fall in place. But they have to be consensual, respectful, and whatever you expect for yourself, you should be able to give to the other in terms of respect and everything. So no harassment, no coercion. I think we have no time to talk about consent and everything because it is already full. But
so you
thank you very much.
Two words about consent. You can, and we can close there with your consent.
Consent is one thing which is, as she said, there is a legal part of it, below which age or whatever. But beyond that, for all adults, I would say that consent is not just saying yes or no, or just feeling that yes is yes and no is no. And when someone says yes, it always means yes. When one says no, it always means no. It's not like that. In relationships, it's an evolving thing. And for every moment, every occasion, you have to respect the other person's wish to participate, not just participate, but enthusiastically participate in the relationship. And as we were talking about, whether it could be it is not only about the sexual intercourse. You ask this question, when do we tell our children about sex? And the question comes because people are asking about when do you talk to children about sexual intercourse? It's not. It is you talk, as we said rightly. So it is not just to have a consent for a sexual intercourse. It is for touch, it is for kiss, it's for hugging, it's for all kinds of sexual exposures, skin to skin. But beyond that, we were talking about internet, showing pornographic things, showing things which one does not want, taking pictures of someone when someone else is not consenting to. I think every aspect of whenever two people come together, I think there is a matter of consent. Two adults coming, everything. And that has not to be assumed that just because we are married, there is a consent. It's so funny thing, like the marital rape is not recognized in our country. It's such a funny thing. Because probably the marital violence is next to child sexual violence. And I think these are the kind of things which we need to evolve through discussions like this. And for every occasion, whenever two people are interacting in a space of sexuality, I think someone else should be consenting to that. That's consent.
Yes. Thank you, sir. Thank you, Dr. Vinay. Any last comments, suggestions, remarks that Dr. Anjendra would like to make to our audience today?
No, like Sir ended, Dr. Vinay ended, I think every space can be about a space of sexuality. And, a consent is very important. We cannot take it for granted. And I think we've touched upon so many interesting aspects, which cut across, the intersectionality of mental health, sexual health. So I think this is a great platform. I think I've had really, really enjoyed this session with the other two, really, really informative panelists. So I think things like this, are the need of the hour in whichever forums. Okay. So I'm really glad you've taken this initiative.
Thank you so much, Dr. Anjendra. Dr. Sangeeta, any closing remarks?
Yes, I would like to say that our principle and our aim of sexuality education is that we are able to experience our own sexuality without any guilt, with respect for our body parts and its functions, and that we are able to express it with responsibility in a way that is not harmful to either myself, the person, or others. So that is sexuality education for me. If we can get to that space where we have pleasure, positivity, responsibility, and respect for the body and its various functions.
Excellent. I would now close this session. I know there have been a number of questions that have come on our YouTube chat. And what I would say is that we will try and answer all of these through FAQs that we will post on our website post this session. But I take this opportunity to sincerely thank all our three panelists, Dr. Vinay Kulkarni sir, Dr. Anjendra Targe, and Dr. Sangeeta Saxena, for enlightening, educating, and providing such beautiful information through examples. I really, really thank you on behalf of our center as well as on behalf of Symbiosis International University for coming and attending this session today. To end, I would say that sexuality is much, much more than sexual intercourse. It is not really the number of orgasms that you have. It is the energy that motivates us to find love, warmth, intimacy. And therefore, sexuality is sacred and not a secret. With this, I end today's session. And once again, thank you to all those who attended our session.
Thank you.
Thank you.
Thank you. Thank you.